Good evening. I'm Waukesha Horn with the Division of Healthcare Facilities Long-Term Care Unit. Today I'll be speaking to you regarding F625 and the Notice of Bed Hold. As stated in the regulation, the facilities are obligated that before a nursing facility transfers a resident to a hospital or the resident goes on therapeutic leave, the nursing facility must provide written information to the resident or their representative that specifies the duration of the bed hold, the reserved bed payment amount, and whether or not the resident would be permitted to return to the facility. In a little while, I'll speak to you about what is considered therapeutic leave and the state plan regarding the bed hold policy. The intent of the regulation is to ensure that residents are made aware of a facility's bed hold and the reserve bed payment policy before and upon transfer to a hospital or when a resident takes a therapeutic leave of absence from the facility. All facilities must have policies that address a resident's bed hold during a period of absence, and we'll discuss in a little while what that period of absence is. Facilities must also provide written information about these policies to residents prior to and upon transfer, regardless of the payment source. So therefore, when it says prior to, that means during most of the time that occurs during the admission process. And upon transfer means when they send someone to the hospital or prior to them leaving the facility on therapeutic leave, that bed hold information is discussed again, and there's written information provided to the resident and or their representative regarding the bed hold policy. As listed in the Alabama Medicaid policies and procedures, the long-term care bed hold policy, effective back September 1st of 2000, neither Medicaid residents nor their families nor their sponsor may be charged for the reservation of a bed for the first 4 days of any period during which a Medicaid patient is temporarily absent due to admission to the hospital. So that's the bed hold policy that talks about for the first 4 days. Medicaid allows a Medicaid recipient to be away in the hospital 4 days before the facility has to charge them or offer a bed hold. The 4-day hospital stay does not apply to Medicaid eligible residents, patients that are discharged to the hospital that their hospital stay is being paid for by Medicare or another payment source, as for instance a private insurance company. The bed hold policy does not include or does not apply to residents that are not Medicaid recipients. It also doesn't apply to those who have applied for Medicaid but has not yet been approved for it. And then lastly, it does not apply to Medicaid patients who have received a notice of discharge from the facility for non-payment. Payments to the nursing facilities may be for therapeutic leave to the home, relatives, or friends up to 6 calendar days per quarter. And those quarters start at January and go through December. So the first quarter would be January, February, March. The therapeutic leave may not exceed more than 3 days per visit each time. And the resident can take that therapeutic leave 1 day, 2 days, or 3 days during that visit, but not to exceed more than 6 days per the quarter, and they cannot combine. Say, for instance, they didn't take any therapeutic leave in the first or second quarter, but they want to save up those 3 days for the third quarter. You cannot combine those visits. It cannot exceed 3 days at any given time. And for the therapeutic leave, the facilities must obtain a physician's order for the therapeutic leave. Some key facts regarding bed hold. It's a two-part process. As stated in the earlier, the first notice of bed hold is given during the admission process, and that's where they explain to them, and there is normally a form that they sign that says, yes, I would like to bed hold, or no, I would not like to bed hold. Whether or not they check yes or no in the beginning, there is another notice that has to be given prior to going to the hospital or on a therapeutic leave. So that first notice is given during the admission process, and you can check for that in the admission packet. Normally admission packets are given to survey teams during the entrance conference of the facility, and then also just check that resident that you're inquiring about, check that admission packet that was signed by either the resident or their representative to ensure that there was bed hold information provided to them during the admission process. The only time that someone will have to reissue that first notice is if the facility's policies change or if the rules and regulations up under the state plan has changed. The second notice is given, must be provided to the resident and, if applicable, the resident's representative at the time of transfer, or in the cases of an emergency transfer, within 24 hours. Normally, that's when the facility will send a resident out to the hospital for treatment and evaluation. They would need to also send along, or within 24 hours, provide written information regarding bed hold to the resident or the resident's representatives. And as stated previously, that information should be written. It's not just verbal. It has to be written information provided to the resident and the resident's representative, because that information should let them know. For the Medicaid resident, it should say the first 4 days are covered by Medicaid. If you wish to come back to this particular bed here, then this is the amount that you will pay. If you wish not to bed hold and you want to come back, then you'll come back to the first available bed in a semi-private room. The notice should include information regarding the duration of the bed hold, if there's any. For Medicaid residents, they get the first 4 days. Medicare does not pay for bed hold, and neither does the private insurance company or any other payer sources. It should talk about what the payment cost is for bed holding, as well as permitting the resident to return to the next available bed. Medicare, again, I cannot stress this, Medicare would not pay for the bed hold, so you will have to find out the payer source for the resident that you are inquiring about regarding a transfer to the hospital to find out what their payer source is. Regardless of the payer source, facilities must make all residents aware in writing of their policies related to bed holds during an absence from the facility. Okay, we'll talk a little bit about the investigative procedure. So while you're on site and you're reviewing your closed record reviews and you're looking at that resident that has been sampled for discharge to the hospital, you will review that medical record for evidence of whether or not the bed hold was provided prior to and upon transfer. You would also review the facility's policies and procedures regarding bed hold. As stated previously, all facilities should have policies and procedures regarding bed hold and therapeutic leave. Review the admission packet to determine if the notice of bed hold is discussed during the admission process. I know a lot of times admission packets are given to residents and family members, and there's 80 pieces of paper and they're just told to sign here, sign here, sign here. They should make sure that that information within that admission packet covers or talks about bed holds and therapeutic leaves. If you determine that the facility's admission packet does not include that information, ask the person that's responsible, how do they notify residents prior to and upon transfer of the facility's bed hold policies and procedures. You would also ask the resident, or if applicable, the resident's representatives, whether or not they receive the notice of bed hold, and also do they understand the facility's policies regarding bed hold. And we don't want to always take the facility's word that they gave them the notice, or you might hear them say, well, when we sent them to the hospital, we sent it in that packet of information. Normally that packet of information goes to the hospital staff that's caring for the resident, that's receiving that person, and they won't know to give that bed hold information to the resident or their representative. It's the facility's responsibility to make sure the resident and their representative, if applicable, has that information regarding bed hold notice and readmission back to the facility. Some of the resources that are used during the investigation of whether or not the facility is in compliance with F625. There is a critical element pathway in the ASCQ information. It's titled Hospitalization Critical Element Pathway. There are different things within that pathway that explains to the surveyor what to do in order to determine a facility's compliance. It states for the resident or the resident's representative or that family interview that you're conducting, ask the question, did the facility give you information about holding your bed while you're at the hospital? Also, it talks about doing the record review, because to cite deficient practice, we always need two sources of information. So that one source is the interview with that resident or their representative, whether or not they received the bed hold information. The next comes the record review, because there should be written evidence that the bed hold policy and the notice was given to the resident or their representative. So in that record review, you should look to see, did they receive the notice of bed hold as stated in the regulation. We'll also review the admission information that's provided during the entrance conference, as well as look in the admission information that's provided to that resident or that responsible party. The admission information more than likely will be in a separate record and not the medical record. You will normally probably have to go to admissions or to the bookkeeper regarding that admission paperwork that was signed and given to the facility during the admission process. Ensure the resident was provided the notice of bed hold, and there should be written evidence. I can't express it more, there should be written evidence regarding the bed hold notice that's given to the residents or the representatives. Also in the record review, it says, did the resident representative receive notice of bed hold? If they did, there should be documentation again regarding whether or not that was given. Within that documentation, I'm going to back up for just a little bit. Within that documentation regarding the bed hold, make sure it includes the duration of the bed hold, what's the reserve payment, as well as permitting a resident to return to the facility. We've recently received complaints in our office regarding the facilities not accepting residents back to the facilities, as well as I didn't know that I had to bed hold. Recently we cited a facility at F625 because we found deficient practice where the facility did not issue the notice of bed hold. This resident had been a resident of the facility for greater than 2 years, had been in and out of the hospital 4 or 5 times, and neither time they were given notice of bed hold. During their last hospitalization, the facility stated that they would not accept the resident back because they did not bed hold. Well, the bed hold information was never discussed with the resident or their representative relating to bed holds and the duration. The facility was not able to provide written evidence of a bed hold notice. They also explained to the resident's representative that in order for them to take her back, they would have to have a payment in excess of $12,000. And they used that $12,000 based upon what the payment amount for when the resident was admitted over 2 years ago. We did not know. Basically, there's also a lot of changes every year. The Medicaid looks at the patient cost, and so that information that they gave to the family was inaccurate because that was the cost based upon when that resident was admitted 2 years ago and not what the current cost of bed hold would be. So just make sure when they send someone over to the hospital, make sure that notice includes the duration, the reserve bed payment, and whether or not that resident would be permitted to return to that facility. Lastly, on the hospitalization critical element pathway, there is a section that's titled Critical Element Decisions. And the number 5, if you go down, says, did the facility notify the resident or their representatives of the policy for bed hold, including the reserve bed payment? If not, you cite F625. And based upon the scope and severity of, normally we look at not providing notice of bed hold as a second level deficiency, D, E, or F. So it all depends on what's the magnitude. You have to look at each situation different, but typically we are seeing it being cited at D level deficiencies. References that I utilized during this process of gathering this information regarding the notice of bed hold was to consult the Alabama Medicaid Agency regarding what's considered bed hold, the duration, as well as what they consider a therapeutic leave. We know that for Medicaid, it's 4 days. So anything, if you have a Medicaid resident that's out to the hospital greater than 4 days and they have not reserved or paid for bed hold after that 4th day, they can be considered a non-covered bed hold. So when you enter the facilities and you are asking what's your census, and also you ask, are there any bed holds? Those bed holds that they should be including are the ones that are still within that 4-day time frame or any paid bed holds. And so that's what it should include. If a resident has been out of the facility greater than 4 days and have not paid a bed hold fee, we should not be including those residents in our the total census of the facility. Also utilize the State Operations Manual, Appendix PP, which is the guidance to the surveyors for long-term care facilities, as well as reviewing the critical element pathway for hospitalization. You can find that in your updated ASCQ. It's Form CMS 20123. That form last updated May of 2017. That's all the information that I have to present regarding the notice of bed hold. In the future, we will delve more into admission, transfer, and discharge. But today, we just really wanted to cover the notice of bed hold to make sure that the facilities are in compliance with F625. If during the course of reviewing this information you have any questions and or comments regarding the content or what was discussed in this webcast, please contact your supervisor. And I always have an open door policy, and I'm available via telephone, email. So just let us know, basically, if you have any questions or comments, or if there's something that I maybe stated that you're unsure of, and you want to make sure that you are making, I guess, the best compliance decision possible, please feel free to let a supervisor know. Again, thank you for watching, and I await any comments and or questions. Thank you.